Summer is supposed to be a time of fun, relaxation, and enjoying all sorts of events like going to the beach, summer camps, fireworks, and spending time at the lake. But for kids with sensory processing disorder, it can be a season full of stress and challenges. In fact, for many families, this is when they first recognize the signs of sensory issues in their kids, noticing they're easily overwhelmed in big crowds and with loud noises, can't handle transitions well, and struggle to stay calm and regulated in the heat. Sadly, sensory struggles are increasingly common, with 1 in 6 kids today experiencing sensory processing disorder, or SPD, and facing various challenges every single day. Their nervous system struggles to filter and regulate normal input, leaving them in a constant state of sensory overload. Sadly, pediatricians often dismiss parents' concerns by saying it's just a phase. However, the truth is that early intervention is crucial for children with sensory processing disorder to thrive. More importantly, these interventions must address the root cause of SPD rather than merely providing temporary workarounds that may be helpful but are not sustainable in the long term. This video is for parents who suspect their kid may have sensory processing disorder and want to understand the signs, causes, and available care options. We will dive deep into all aspects of SPD, exploring how a perfect storm of factors contributes to its development. Additionally, we're going to discuss how neurologically focused chiropractic care can help restore balance to your child's nervous system, providing relief and improve their overall quality of life. Now, like we previously mentioned, sensory processing disorder affects a staggering 1 in 6 kids, with numbers continually rising. Despite this prevalence, SPD is frequently overlooked or misunderstood by healthcare providers. While SPD often coincides with autism, they are two distinct conditions. Children with sensory challenges may exhibit age-appropriate skills in some areas, while struggling with pronounced sensory-based difficulties in others. We are going to go over an extensive list of some of the most common signs of sensory processing disorders in kids. So one of the first things we see is oversensitivity to touch, clothing, sound, smells, lights, and new food. Children may feel discomfort with certain textures, avoid being touched, and experience distress from tight or itchy clothing. They might cover their ears in response to normal sounds and have a fear of loud noises like vacuum cleaners or sirens. You may also notice sensory seeking input. Kids often seek strong tactile sensations by constantly touching objects or engaging in rough play. This behavior is a way to satisfy their need for sensory stimulation. But you can also see they may avoid sensory input. Some children avoid activities that involve physical contact, such as hugging or feeling distressed by everyday activities like haircuts or brushing teeth. They may withdraw from these situations to avoid discomfort. Difficulty with fine motor skills. So tasks requiring precision, such as buttoning clothes, using utensils, or writing, can be challenging for kids with SPD. They might struggle with these activities due to coordination issues. You may also notice difficulty with gross motor skills. So activities that involve larger movements, such as running and jumping or riding a bike, may be problematic. Children might find it hard to perform these tasks smoothly and effectively. And along with this, noticing balance and coordination issues. Frequent tripping, falling, or appearing clumsy are common signs. Children with SPD often struggle with maintaining balance and coordinating their movements. You'll also notice poor body or spatial awareness. Kids may have difficulty knowing where their body is in space, leading to frequent bumping into objects or people. This lack of spatial awareness can affect their ability to navigate their environment safely. They may become overwhelmed in crowded places. Crowded environments like stores, parks, or parties can cause significant distress or anxiety. Children with SPD might feel overwhelmed by the sensory input in these settings. Also, difficulty transitioning between activities. So transitioning from one activity to another or moving between different environments can trigger meltdowns or anxiety. These children often find changes in routine particularly challenging. Also, emotional outbursts. Frequent tantrums or meltdowns may occur in response to sensory overload or frustration. Now, these emotional outbursts are a way for a child to express their discomfort and inability to cope with all of the sensory input. Also, difficulty self-calming. Children with SPD often struggle to soothe themselves when upset, requiring external help to calm down. They might find it hard to manage their emotions and return back to a calm state. Hyperactivity or inactivity. So this is depending on the sensory input they seek to avoid. Children might be excessively active or lethargic. Their activity levels can vary significantly based on their sensory needs. Difficulty sleeping. So sensory sensitivities can lead to trouble falling asleep or staying asleep. Children may be restless at night, affecting their overall sleep quality. Also, you may notice poor attention span. Staying focused on tasks can be difficult due to sensory distractions. Children with SPD are easily diverted by sensory stimuli, impacting their ability to concentrate. And then also repetitive behaviors. Engaging in repetitive motions or actions is a common way for a child to self-soothe or manage sensory input. These behaviors provide a sense of control and comfort amid sensory chaos. This brings us to the next question. What's really going on with the nervous system in SPD? Sensory processing is a three-part process. So first, the sensory input comes in through the sensory nerves and sensory aspect of the spinal cord, reading information from both the internal body and the external environment. And second, the brain and the central nervous system must process or interpret sensory information and determine what is important to pay attention to and react to, and what is not important and should be filtered out or essentially ignored. And then third, the brain and the nervous system then send information and what are called actions or impulses out to the various parts of the brain and the body to react and respond to the incoming sensory input. When the sensory nerve pathways into the brain and the nervous system are altered and interfered with, the brain and the nervous system then receive bad information, and in turn, that leads to poor decision-making or interpretation, and finally, bad or inappropriate actions and outputs because of this bad information and improper processing or interpretation of the sensory information. So bottom line, SPD is a neurosensory communication and connection problem called subluxation or nervous system dysregulation. Once you understand subluxation and nervous system dysregulation, you can truly grasp the root cause of SPD. By addressing these underlying issues, you can help your child find relief and thrive. We have been asked by many parents, why are sensory issues and subluxation so difficult to identify and make sense of? Well, first, traditional pediatricians and medical doctors do not have a good understanding of SPD and neurosensory function as a whole. And second, no traditional medical testing or even movement-based therapies like PT and OT are equipped to find and detect subluxation and nervous system dysregulation. While the root cause of sensory processing disorder may escape most common medical diagnostic testing, our neurological insight scans are literally designed to find subluxation, nervous system dysregulation, and dysfunction, and help parents see with their own eyes exactly what's causing their child's frequent tantrums, meltdowns, and sensory difficulties. If you feel like you've already done months or even years of OT and made all sorts of sensory workarounds part of your normal everyday life, and you just want things to be easier and less modified for your child and family, you need to learn more about exactly how neurologically focused chiropractic care works. This specific form of chiropractic care that we provide at E320 Chiropractic can do so much for kids struggling with sensory issues. Help your child and whole family get back to an easier, calmer, more consistent quality of life with chiropractic care. To learn more or schedule an appointment, simply visit the link in our bio, leave us a comment, or send us a direct message to get connected to one of our care advocates right away.